Okay, so would I have biologic procedures performed on myself or perform them on family members? The answer is yes. Obviously, I had it done on my elbow. If you follow my post, you see I had the bone marrow cells that has the stem cells and other cells that help the stem cells, and the PRP. Been getting laser, been getting total body fitness, and my elbow feels probably 90% better at, I think I'm 9 weeks tomorrow. And then this is Kevin, you saw him in one of our other posts. This is my son-in-law, and he underwent the bone marrow cells and the PRP injection into the patellar tendon for a very significant partial thickness patellar tendon tear, tendinosis, which means degeneration. But you can see it's not all that swollen. We did the injection into the patellar tendon. You can't even really see where that area is. It's a little bruised. We put some into the knee intra-articularly through an injection right in this area. But he was asking me today, he said, this knee feels a little warm. Well, I mean, anytime you hear warmth, you worry a little bit about infection, right? But also we know that increased blood flow and healing causes warmth. More blood flow causes warmth. So his other knee, really, if you feel the two, and there is some, you get used to feeling things. This is a little bit warmer on the right than on the left, but why is that? Well, number one, PRP has platelets in them, and the platelets release these growth factors, and the growth factors stimulate new blood vessels and cells to come into this area. So new blood vessels, a lot of blood flows coming into the area. Also, the actual cells, even though we think that stem cells or bone marrow cells or other cells that help the stem cells actually turn into tendon, they probably do, but they have more of what we call a paracrine effect, where they release factors or actually touch other cells and tell other cells what to do. So they also will cause increased blood flow and increased biologic activity, which will lead to some increased warmth. So really, this isn't all that warm, but it's a great question. Patients ask it. I mean, honestly, my elbow was pretty warm on this side. It's back to normal, but that's basically the healing process going on and all the increased blood flow, and it's a good thing. But always worth asking your provider about if you're worried about.